I'd like to introduce our next speaker, who's no stranger to us, Mr. Göran Henriks. He is Chief Executive of Learning and Innovation at Equitable in the County Council of Jönköping, Sweden. Equitable is a center for quality, leadership, and management development for the employees in the county, and also for the health care service on the regional and national level. Göran took up his appointment in the start of Equitable in 1998. He has over 20 years experience of management in the Swedish healthcare system. Göran is a member of the Jönköping County Council Strategic Group. He has been Jönköping's project director for the Pursuing Perfection initiative over the last 4 years and is a senior fellow of the Institute for Healthcare Improvement, Cambridge, Massachusetts. In addition, he is part of the strategic committee of the International Forum on Quality and Safety in Healthcare, organized by the BMJ and the Institute for Healthcare Improvement. Today, Göran will be sharing about the transformation of the Swedish welfare system and their strategy for health. Sorry for the long introduction.
Good morning, everybody. My name is Göran, and I'm coming from a region named Jönköping. Would you like to try to say Jönköping? Jönköping? That's great. Oh, that's my clicker. Thank you. I'm very honored to be here, and I think it's a fantastic work going on here, just as Jonathan mentioned many times. So it's a privilege to work and be in an organization as you are, and having CHI as a perfect support resource for improving health and care. Now, tomorrow is a lot about collaboration, connection, co-creation, co-production, coaching and communication. And I think that my presentation will be more about those words than really the title. But who am I then? Well, this is me. I'm not sure if it works. This is my wife. This is my Afghanistan guy, Ali, that lives in my house since 8 months. And it's very important to understand how life is for other people. And Ali teach me a lot about what life is, having 2 sisters in Afghanistan and a mother, and all other relatives are dead. And he went to Iran to start to work and said, "Mother, I come back soon." And then suddenly he was in Sweden, and he cannot come back without being forced to go back by the Swedish government. And he has no decision about this, so he just lives in my house. And it's his girlfriend from Somalia that came 7 years earlier and have a Swedish permission to stay. Now, this is my children and their boyfriends and girlfriends, and here I'm not a leader in the same way. Here, I guess, today I'm a learner because they are 23, 25, and 27, and they teach me life in a new way. And this guy here is an architect. He's more like a hipster, but he loves to teach me about architecture, and I come back to that. And then here, up here, there I am a butler. You see my mother, 94 here, and this is a group of women with an average age of 97 years of age. The oldest one is 102, and they meet every Tuesday and Thursday. And you know, at that time, when you are that old, life is a little different, because then it doesn't matter what social background you come from or what interest you have. Then life is important. So they call each other every day and just listen to each other and see what is important for you today. How can I help you today? Why did I say I was a butler? Well, they come to my summer place once a year, and they love to make me as the person that served them white wine. They don't drink more than this, and eat some fish and sitting in the sun and just talking about their lives. Now, working in healthcare has two realities. A lot of people think that working in healthcare should be like the calm water. But I think that the most joyful place to be in is in the river, where the water is very quick. But I know that a lot of people search for the other place. So therefore, we need to learn skills how to live in the fast water. And everything I say today has a platform in Edward Deming, and the idea is that the front employees should understand how to improve its own work and work with the work. And some of the tools are illustrated here. But what I'm asked to talk about is not about the microsystem development, but how can you think about the macro system change? So in Sweden, we try now to change how we approach all public welfare systems at the same time. And I'm the coach of that work, and I'm going to share some of the learnings from that. It starts with my son, the hipster, because he says that Jane Jacobs is a person you have to study. She describes the importance of how to build cities. Cities has to have integrated systems according to how they are used. And the sidewalks, the parks, the retail design, and the ideas of self-organization are very crucial. Otherwise, the city dies. And you know, United States have had some problems with cities that dies because it's just offices and the blocks are very big. Now, when we think about the cities, we have to look on cities that are very strong and very successful. And they are designed so every block can live in itself. So they have a grocery store, so they have a laundry, so they have a garage for the cars, and you can wash them in that garage. And they have meeting places so people can take care of their own context, their living surface. So it doesn't matter if some companies move out, they will continue to be strong. Now, if you reduce that to science, it starts with thinking about what are the key measures of success for a block. And if you can define the key measures of success for each block, you build an infrastructure with many microsystems that loves to be together. What are the cultural things that is important to think about? What are the operating rules? And what are the overriding self-interests that preserve the status quo? This is our change strategy of our welfare systems in Sweden. I just wanted to remind you that future health is not tomorrow. It is about what decisions and what measures you use today. The future is now. And it starts with co-production and segmentation and simplification. In my region, we not only have Esther, the old woman that is 82 and needs a special focus because she needs our professional knowledge. Now today, we have identified 5 different segments where my system have to measure our competence and our results in. It is Esther's daughter Britt-Marie, it's Britt-Marie's husband, it is the grandchild Sigge, and it is the mother Malin. And we have built stories about these individuals that we can describe for all people that work in our healthcare system. So they are real for us. We talk about them as human beings. Now, Esther has been so recognized that the European Union have nominated her to being one of the most important social innovations in Europe. So, what do I mean with transform the welfare system? That means that we today merge the schools, the elderly care, the social service, and health and care into one system. Do you remember Jane Jacobs? How do we develop the sidewalks, the measures that can define what is important for the whole system? It starts with understanding that everything is about lives. Our success should be measured in how people live and what quality their lives have. It is very challenging because we know that the amount of people that pay for the public system, that's the red line, and the cost for the public system, that's the dotted line, there is a gap that is growing dramatically. So how should we afford to keep the same standard? Another thing is that our systems produce the same result even if we talk about how important they are. So these statistics show that there are between 12 and 15% of our students that after 10 years of school do not leave the school with full grades. And we produce that every year, and no one changes it. My suspicion is that this research that says that 1960, the difference between a full classroom, groups, and individual work was 60, 18, and 22. And 2015, it's 57, 21, and 22. So there is no real change in how we work with the work. They work exactly the same way. So why should there be a different result? But the gap is outside the school because the new way of living with all connections change dramatically the learning habits of all people. But the schools look the same. We see that our country produced the same situation for people that have 10 years of school education and people that have between 14 and 20 years of school education. And the people that have longer school education lives longer. We also know that the European Union and the International World Economic Forum has defined what is important for 2030 and says that we have to say farewell to hospitals and instead understand that tomorrow it's about hospital. And here they say that today's Syrian refugees will be CEOs of the healthcare systems in Europe. It's very interesting. Why not? So, are we ready for a new way of working? Where we can work with our work processes in a systematic way. Let's listen to one of our patients in Jönköping. I hoped I should get a video now. That's right, I should say video. Let's see what happens.
My name is Sarah Rigger. I live in Stockholm, Sweden, and I do self-tracking to support my Parkinson's disease. So Parkinson's disease is a very complex disease that is caused by a lack of the neurotransmitter dopamine in my brain. To manage it, I take a lot of medications. To keep my hands from not stiffening up, I try to do crocheting or knitting to keep them as agile as I can. And I also do exercise to keep my symptoms at bay. I started tracking basically because I don't see my doctor very often. I see my neurologist 1 hour per year, and the rest of the year I spend in self-care. That's when I can manage and take care of myself the best way I can. To do that, of course, it helps to measure, to help know if you improve or not. To track my activities, I use my smartwatch or my smartphone. I track when I have a reason for tracking. So I track maybe when I change the medication or I think I have a new symptom. I don't only use technology and devices, I also just observe and make notes on pen and paper or in files on my computer. My doctor is very interested in the way I collect data because he finds it gives us more information for forming a joint decision about my treatment. In terms of understanding the patterns of the disease, the data is really essential. There are lots of self-trackers in different countries. So we share information, we share methods, we have a lot of common questions and common issues to deal with. Self-tracking is a very powerful tool for the future of healthcare. My being able to do almost everything I want to do, in spite of having Parkinson's, is the way I've observed and optimized my treatments.
So, Sara has now started a university program in Sweden that is delivered in Stockholm and Lund at the same time for individuals that have a disease but think that they are healthy. And it's all about self-tracking and being the provider of healthcare. The new model is about click, call, and walk. Click, call, and walk. It's not about patients. It is about individuals and citizens. Now, Bill Gates told us that in 1999 that there is a need to change the view of what is important. And based on this book, you can maybe do a formula or equation of that data plus resources times points of contact divided with the contact yield makes an interaction value. We need to start to measure horizontal integration and the interaction value. And change, why are we here? We count our success in lives. And a German philosopher, Gadamer, says that health is that you enjoy can be occupied with your own life tasks. That means that we have to redefine, and now come some principles, our thinking about health. We have to support people to support themselves, take self-management to the edge, easy to get access, but easy to get out. Redefine the service. It's about co-creation. And it's not about moving people, it's about moving knowledge. Remember Sara. It is about changing how we develop value. We have to have kiosks where people can come easy in, easy out. We have to help people to support networking so they can support themselves. You heard that she had a network over the whole world. And we have, of course, to use all our quality management system tools in some clinical areas as surgery and orthopedics, so you get quick in, quick out, and no longer than 1.5 days at the hospital if everything works. But we also need, just as Jane Jacobs said, a dashboard of important measures that show that we have a lot to do. In Sweden, that is very healthy. We know that about 85% of all healthcare costs are related to chronic disease. We know that at least 150,000 children lives with violence every day. We know that behavior problems at the age of 8 show approximately 62% probability to a psychiatric diagnosis. And we know that half of the psychiatric diagnosis debut at age 14. We know that it is 10 times more common to report bad health when you have a disability. And we know that approximately women with disability report good health compared to 70% of women without disability. And we know that men's violence costs a lot of money. And we know that 6 out of 10 in groups with short, low education live shorter lives. And we know that 4,200 fewer cases of illness in 2022 can reduce the cost dramatically. And we know that if we reduce the number of students outside the community, we can save so much money to the community and the people that pay tax. And we know that all this can save so much money. For example, if we change the way we work with people that have risk for falls, we can save about 14 billion kroner every year. So we have a lot to do, of course, but we have to segmentize it to the different phases in life, and we have to work with our microsystems that every day run for these results. But it takes a new management approach where you can work with good and equitable health, best possible quality, and reliable, sustainable care at the same time, not one area at a time. So we have said to the schools, to the municipalities, to the counties, that you have to show us how well you are doing, and this is just an example of indicators. We have about 25 indicators following the whole life that they can start their work from and show the gap between the best and where they are. And it is divided into different phases of life. And you will get these PowerPoints, and I can share with you the rest of the indicators. So maybe one municipality will come up with, we want to work extra with residents between 17 and 24, or students in grade 5, or remaining life expectancy at birth. Everything about health, because health comes before diseases. And we know that everything is connected. So we have to engage all the different resources, and they have to work with the same dashboard. Now, on my level in the region, we at the same time have involved everyone in the idea of moving resources from the right to the left in this picture. That takes engagement of all different resources in a completely new way. And the same management idea, Jidoka, that you have to work with prevention in different ways all the time. How can we reduce the need of our competence? Now, that means that the primary care system have to be what I call the quarterback. In American football, there is a person that is very good passing the ball and valuing who should catch that problem, the ball. So we move from having the competence in the hospitals to having the quarterbacks in primary care, because they are the organization that can communicate with all the other resources. But it takes that we use the segmentation and do a person-centered process value mapping for each disease and improve our work based on that. And that takes the idea that you have microsystems that are so engaged to support the whole system's result, and the leadership from beneath that support that work. Now we have developed a same strategic approach for all hospitals in Sweden and all primary care, and it says that we should work with 19 different work groups or disease groups, and the chairman of each group should be a primary care doctor that defines the program of each disease group. Why a primary care doctor? Well, that's the only way to make it simple enough so people in healthcare can really follow the guidelines. What happens if you do like this? This is a result from our diabetes work and HbA1c. This is before collaboration and this is after collaboration. And you can see that all the red bars have improved dramatically. It takes that you come together and work with the clinical results and performance. But this change does not come by working only with the specialty care. You have to work with the schools, you have to work with the family centers, you have to work with all the resources to make this happen. This is more a specialty thing. Here you can see how we have reduced the amount of days you have to be at the hospital after a hip replacement. And the hip replacement today in 3 hospitals in Jönköping, more than 80% of the patients go home the same day or the day after the operation. We try to learn from engaging many different groups out in the society about prevention and health. Here you see some examples, and we have maybe 5 to 10 more examples of groups that help us to design how we should work. So we really go for the co-production approach. Now, that brings the focus from what is important here to what is important for the people that pay the work we are doing. But it takes some managerial approaches. One is we have to be clever in segmentation so we work with the right group in the right way. Some people are independent and committed, others are worried and committed, others are traditional and unscathed, some are very vulnerable, and you cannot approach them the same way. So right now we try to teach our people how to read what is important for the person I work with and customize the approach. This gives us joy because suddenly it is actions together with the patient groups and how they improve and how they can support each other that helps us to achieve much better results. But it takes a new kind of leadership, a leadership that understands that we have to do the same way all over the country. 10 million people 2,000 kilometers between south and north, completely different from Singapore. But the digitalization gives us this possibility directly. A more strategic and knowledge-based leadership, even in the schools. So we who know this knowledge to spread to all other places. We have to strengthen the ability to lead in complexity, change and improvement, so that basic quality improvement tools are even more important. And we have to increase the attractiveness of leadership and strengthen the conditions for daily processes that is viewed in a horizontal, integrated process. Why? Well, the only way to be a bird also tomorrow and use the wings is like the bird who is sitting on a tree that is never afraid of a branch breaking because her trust is not on the branch but on her wings. And tomorrow needs completely new wings. Thank you very much.